Hi, I'm Dr. Errol Williams. I'm a cardiologist at the Avita Health System. I became a doctor because it was what I always wanted to do, ever since the age of 3 years old. I had a lot of relatives who were physicians, and I thought that this would be something that I would want to do with my life. And it really appealed to me, the idea that I could reach out and help somebody who was suffering. I chose cardiology because I realized that I was good at doing cardiology when I was going through my medical training. Cardiology fit in terms of my ability to do procedures and my intellectual capacities and so forth. I have a special interest in congestive heart failure therapy and preventive cardiology. And I think it's really important for us to try to intervene in people's health before they become incredibly sick and we have to spend all of these dollars at the end of life. The best part of my job is really being able to help people. Being a doctor, but particularly being a cardiologist, allows you to do that. You can reach people who are dying and you just pull them back to life, and it's a wonderful feeling. And you can also just improve people's lives, which is just as important as saving them at the end of their lives. I connect with my patients by trying to interact with them as a human being. So I will use my experiences, my personality, my interest, and try to relate to who they are. And I always think about patients in the same way that I would think about my own family members. I give them similar advice. I chose Avita because I was in northern New Jersey about to sell my private practice to one of 3 different healthcare institutions. And I spoke to a consultant who was working with Avita at the time, and he suggested that I consider coming to Avita. And after talking to him for about a year about that possibility, I finally decided that it represented a unique opportunity for me. 1, I would get to start a cardiology program, which I'd never done before. And 2, I would actually then treat a rural community of people who would never have had access to a doctor like myself unless they went into a major city center. I have a lot of hobbies. I've been a lifelong exerciser, so I'll run, I'll lift weights, I'll play all kinds of sports. I swim, I snorkel, I hike, I do things like that. But I also sing, and I trained my voice classically, and I did musical theater, and I also ballroom and Latin dance. I'm Dr. Errol Williams. I'm a cardiologist at Avita Health System.